Welcome to VerifiedRx, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Direct-to-consumer healthcare is rapidly moving into the mainstream. The U.S. direct-to-consumer telehealth market is projected to grow more than 30% annually through 2030, fueled in part by generational shifts in healthcare expectations. Today, Emily Fitt, Hailey Mulliner, and Heather Pace join me to discuss the rise of direct-to-consumer healthcare platforms, where they are expanding, why patients are using them, and what this means for traditional healthcare models. I'm Stacy Lauderdale, AVP of Evidence-Based Medicine at the Center for Pharmacy Practice Excellence at Vizient, and your host. Emily, Hailey, and Heather, welcome to the podcast, and thank you so much for joining me today.
Thank you for having me, Stacy.
Thanks for having us, Stacy.
So ladies, I recently read a statistic that 3 in 10 Gen Z and millennial consumers now use telehealth for healthcare visits, compared with only 6% of baby boomers. There's been a change around patient expectations around access and convenience. Where are direct-to-consumer healthcare platforms gain the most traction today, and where do you see the most opportunity for expansion?
When we look at specific disease states, historically, there have been a few that the market has already shifted to direct-to-consumer offering. Men's reproductive health is a perfect example of this. The shift has already happened to direct-to-consumer. The first shift happened with transactional health, constipation, with sexual health and contraceptives for women. Dermatology and acne was another big one. The pandemic may have been a catalyst for this. As we started implementing more and more virtual services into our day-to-day lives, more longitudinal care started to happen on the direct-to-consumer side. The top two that I can think of are behavioral health and GLP-1s and obesity management.
What's really caused the growth in the obesity management in the GLP-1 space was the shortage of the medications for some time allowed compounding of those to be allowed by the FDA. As long as they were on shortage, they were allowed to be compounded. That's since ceased because they are no longer considered shortage. And so what we're seeing in the direct-to-consumer space is a switch from the compounded version to the FDA-approved branded versions, but we're still seeing a continuation of those telehealth services. What we saw making it grow was the allowance of the compounded medications. Now they're switching to having to distribute or sell the manufacturer, the FDA-approved medications, but we're seeing those telehealth services still remain.
Makes sense those telehealth services are remaining too, because to speak back to that stat you threw out there, Stacy, it reiterates what we've seen in the SG2 consumer survey. Patients are interested in building their own care journeys these days. We're in a culture of Amazon. People want speed, simplicity. They want things when they want it. And it's no different when it comes to their healthcare, which speaks to folks leaning into these direct-to-consumer offerings and these telehealth visits. The only other area I didn't hear mentioned from Emily and Heather is the uptick within women's health offerings and direct-to-consumers. Different companies, different offerings that are out there really targeted towards women are really having a boom right now.
You all brought up some really great points. Beyond women's health, any other areas you think we'll see in the next 5 years direct-to-consumer expand to?
We'll switch to more longitudinal management, so cardiovascular conditions, type 2 diabetes. The ortho market is also having a surge, the Hinge Healths of the world.
Cardiometabolic diseases and an uptick in how you manage that through direct-to-consumer offerings. Maybe you send a patient in to do labs at a third-party lab, but you can manage a lot of the symptoms and other aspects of those diseases through virtual offerings as well.
As we start to see with the GLP-1s and related medications and expanded indications, not only are they going to be focusing on weight management, they may be seeing some of the cardiometabolic parameters changing that then would need to be monitored by these telehealth or direct-to-consumer platforms. That will push a little bit of growth in that cardiometabolic space as well as you start to see some of those indications expand and get approval from the FDA for these medications.
We're going to continue to see growth into areas like cardiometabolic health. Direct-to-consumer healthcare is here to stay for the long term. Hailey, you mentioned there was a consumer survey, direct-to-consumer care, patient empowerment, etc. Is this care beneficial to patients? What are the pros to direct-to-consumer for the patient, and what are potential drawbacks?
Patients perceive it to be very beneficial, but it also does a disservice when you're thinking about a whole care journey. Is a direct-to-consumer company or platform able to manage every aspect of a patient's health journey? I don't think so, because they're so niche, they're so targeted, they're really focused on that area. It just creates a lot more fragmentation in a care journey while giving the perception that the patient has control over their health for that one specific area.
For quite some time. And it's not really been until so many more obesity treatments and weight management treatments have come about that it's been a relatively uncomfortable conversation sometimes for patients. If they can access care in a more comfortable environment, hopefully it leads to more comfortable conversations to then pursue further treatment for conditions that they may not have pursued treatment for because they didn't get the support from their practitioner that they may now, because this has really opened up the conversation in the weight management and obesity arena for patients and health practitioners to get the best support that they need. It provides a comfortable space to open up those conversations and that door to treatment.
We often get the question, what should health systems be concerned about? What should the health system be thinking about the unintended consequences of the direct-to-consumer market? Well, you might be seeing more patients with side effects because at the end of the day, these direct-to-consumer platforms are all virtual. Anything that needs to be done in person, if they don't partner with a third party, the health system is on the hook. You may see more patients needing ED utilization as a result of these medications. It does increase fragmentation of patient care. You're going to one direct-to-consumer company for a GLP-1. You're going to a different direct-to-consumer company for your acne medication. And then you're going to a third direct-to-consumer company for something like birth control, where there's not one person that's managing that whole aspect of your care.
That's a great point, Emily. Heather and I are both pharmacists. And when I hear that, I'm concerned about medication stewardship and really taking the pharmacist out of the picture.
As health improves particularly in the weight management and with the GLP-1s, there may be other medications that a patient is on, let's say it be for blood pressure or some other parameter that improves with the weight loss, ensuring the entire picture is being addressed. That telehealth platform is important because they may need to decrease other medications as they become healthier and more fit with their weight management and obesity medications.
As patients interact with the health system for things like endoscopy or surgery needs, I've heard from multiple teams, our gastroenterology teams and our ortho teams, we often don't know that patients may be on a GLP-1 medication because we as the health system don't prescribe that medication to the patient. But we found out they were on that GLP-1 medication and they didn't stop taking it before they were supposed to get a colonoscopy. And so we're seeing that increase in canceled procedures, which is a big deal to the health system.
Healthcare systems are going to have to adapt some of our screening procedures to recognize that many of our patients are receiving direct-to-consumer care that we may not know unless we ask. One of the quotes I read the other day, it said, GLPs may have done for healthcare what Netflix did for streaming. They changed consumer expectations permanently. And I believe that to be true. When we think about a healthcare system, their next competitor probably isn't another healthcare system at this point. It's a direct-to-consumer platform that makes care easier and more convenient. Should healthcare systems compete against direct-to-consumer? And if they decide they should, how do they compete? Or should it be more of a partnership?
This is a conversation that Emily and I have been having quite a bit over the last few weeks. Should health systems compete? How do they compete? And what does it look like? What's going on with their market? What does their patient population look like? I really like to look at this from a primary care lens because that's kind of the space that you are competing most. How does it stand up to some of these direct-to-consumer offerings in terms of access, in terms of team-based care that you're offering? What are you able to provide your patients that they're seeking elsewhere from these direct-to-consumer offerings? Not every health system will be able to compete, and health systems need to take a good look at some of their patient population data, maybe look at their primary care patients from an acuity level and make a decision of, does it make sense for us to include some sort of primary care offering that competes directly with these direct-to-consumer offerings? You build out a specific niche within your suite of primary care offerings that competes with the direct-to-consumer offerings, building in more of a team-based approach to one of your primary care clinics where you're focusing on those cardiometabolic diseases. You can get creative on what competing with these direct-to-consumer offerings look like, but really health system dependent in my mind.
That plays to the advantage of the health system. The health system has the full continuum of care. If something becomes too severe, if you need something in person, surgery, a screening, imaging, labs, the health system can provide that. The DTC can't. Hailey, what you said about having a niche primary care offering that directly competes with these DTC offerings, but saying, hey, we're the ones that can do it all when your DTC can't, but we can still give you that convenience.
From the GLP-1s and the obesity space, we look at the number of patients that potentially could qualify. It does become an access issue for health systems. So it really needs to be a partnership when they do need the extended services or need something, or like Emily, you mentioned, to be aware that they're coming in on those medications so it doesn't interfere with their care. So it really does need to be a partnership because it is increasing access to the medications that maybe the health system doesn't have the infrastructure to account for that influx of patients in a timely fashion.
Have any of you heard of any examples of partnerships? I've read the suppliers are partnering with other entities other than health systems, but throwing it out for the group.
I haven't seen it yet. The only partnerships that stick out to me is the Eli Lilly partnerships with some of the direct-to-consumer offerings. It's more in that space rather than a health system. Health systems in one medical. It differs a little bit for me there than these direct-to-consumer companies. I would love to speak to any health system that has sought out some of these partnerships because I do believe that if you're not able to build something that competes directly, partnership is the way to go, especially because you're then able to provide that continuum of care. There's a lot of benefits to that partnership. You don't have to worry about those upfront costs, but you're able to then help those patients downstream should they need that higher acuity care. I haven't seen any examples yet. I'm really waiting for those to come out.
I've got to imagine they will. I heard the other day, Amazon's going to be now partnering to deliver GLPs at your doorstep, maybe same day or next day. It feels like every day there's a new and different announcement. What are some other potential impacts of DTC platforms? We've talked about the impact on our healthcare, patient access, fragmentation of care, but what about in terms of workforce impact?
Hailey says it all the time. You are not only competing for patients with your direct-to-consumer competitors, but you're competing for the workforce too.
These direct-to-consumer offerings, there's a lot of different providers employed by them, and they are able to provide another level of flexibility for these providers in terms of what their work looks like. But they are then taking on typically a large panel size of patients because you're just having these quick visits with these patients. You're competing not only with health systems for your workforce, you're also competing with the direct-to-consumer providers. They're hiring very quickly. Their subscribers are growing every day. Providers that are unhappy with their current work environment within a health system, they want that more flexibility. They're looking to these types of companies to move to.
For many of our clients, that workforce is certainly a top of mind concern. What do we see as potential future directions? I know we talked about future directions in terms of therapeutic expansion, but in terms of consumer platforms.
Primary care providers were actually feeling a little bit overwhelmed from patients bringing in labs that they might have gotten through a direct-to-consumer offering that they are now expected to look at. They are trying to help with that care that patients have sought elsewhere, but it really becomes a time and access issue when they're having to read through labs that weren't ordered by them. They didn't establish that relationship with the patient. They're seeing these labs without having full patient background. It ties closely to what are we going to see next with the age of AI and how patients pivot from these direct-to-consumer offerings to then leaning into AI. They're putting their labs in there, and then maybe they bring it back to one of your health systems doctors, and that's a little bit more of a workforce effort to even read through that. I had seen a recent article that there is a specific psychiatric direct-to-consumer offering that has had their AI bots approved to write prescriptions for psychiatric meds. That's really interesting in a where are we going? Where could this grow into? A signal to keep our eye on there.
Well, I don't know whether we know if it ultimately leads to better care, more fragmented care, or maybe a combination of the both. It's clear that these models are certainly reshaping patient expectations and forcing healthcare to think a little bit differently about access, convenience, and how they're going to deliver care to the next generation. So I appreciate Hailey, Emily, and Heather, you joining us today to discuss your thoughts on direct-to-consumer platforms.
Thanks, Stacy.
Thank you, Stacy.
Subscribe today. Like us. Send us your comments. We'd love to hear from you. VerifiedRx is a prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. Thanks for listening.